In the 25 years that I've been a therapist, every single client that has come through my door has had one thing in common. Hey folks, I'm Sarge and I am a therapist, and this channel is all about mental health, things that may help you on your journey towards improving yourself, your mental health. If you're a clinician, you may find some tools in here that are useful. And today we're going to talk about the 3 R's. All right, folks, so I have been a therapist for over 25 years. I've worked with just about every population that you can imagine: children, elders, everybody that's in between. I've worked with first responders, prison release clients. I've worked in the public sector, the private sector, the non-for-profit, the for-profit. I've had a private practice, and every single time a client walks through my door, they have one thing in common. And that thing is that they have an imbalance in what I call the 3 R's. So what is the 3 R's? The 3 R's are rest, responsibility, and recreation. Okay, those are your 3 R's. Now, what do I mean by that? Well, in order to be well balanced, you have to be able to manage your responsibilities. So let's talk about that one first. So your responsibilities is your work, right? And if you are a stay-at-home mom or dad, that can be your work. But you have responsibilities, you have chores, you have bills that have to get paid. Maybe you're a student, so you have schoolwork that has to be turned in. If you're not of working age, then you at least have responsibilities for chores, such as making your bed or doing your chores, cleaning up around your room, maybe doing the lawn, things like that. Those are your responsibilities. The rest part of it is not just sleep. Now, rest is also part of rest is also passive recreation. Okay, it's going to be different from what we're going to talk about in a second, which is active recreation. Passive recreation is things that don't require a lot of physical or mental brain activity. Right? So this can be watching a television show that does not require a lot of mental capacity, right? And it's okay to do this, just not all day long. So there are certain shows that I like to watch where I can just turn off my brain and let it entertain me. There's nothing wrong with that. Passive recreation can also be meditation. It can be Tai Chi, even though that's more active. There's a component of it where you're passively recharging as well. Even yoga, if you're experienced at yoga. Now, if you're not experienced at it and you're learning it, it's going to be definitely more active. But if you're very experienced at yoga, that can be a form of passive recreation. Listening to music, and by listening to music, I mean like not turning on your music and then doing your chores or your schoolwork, but actually turning on music, maybe even putting on your headphones and just closing your eyes and really taking it in. That's passive recreation. Active recreation is a little bit different. Now, active recreation is exercise, hiking, playing a sport, playing a musical instrument. It can also be doing puzzles or crossword puzzles, things like that. Anything that's stimulating to you physically or mentally is your active recreation. Now, in order to be well balanced and recharge your battery and to be able to handle life's little stressors, to be able to recover from depression, to be able to learn ways to cope with anxiety, to recover from trauma, you are going to have all 3 of those in balance, right? So what does that mean? Does that mean 8 hours, 8 hours, 8 hours? No, not necessarily. For most of us, responsibilities is going to take up the biggest chunk of your time. And then your rest and passive recreation is going to be your second biggest. And then the third biggest chunk of your time is going to be your active recreation, but you can't neglect that. And a lot of people, they're struggling in one of those 3 R's. Okay, so you have to take a look at your inventory. How much time am I spending doing activities that I like? So you all know that I like being outdoors and hiking and camping and things like that. That's active recreation. I like working in the garden. That's active recreation, right? Well, when things are out of balance, then maybe that's the stuff that I start taking from first. Or maybe you take out your passive recreation, so you start stealing from your sleep hours, right? Most people are going to need a minimum, and this is bare minimum, 6 hours of sleep. Are there exceptions to the rule? Yes, of course, there's always exceptions to the rule, but most people are going to need at least 6 hours of sleep. The average person really needs 8, maybe even 8.5 hours of sleep, and some people need even a little bit more than that. But if you're overly busy, you're trying to pay for a big expense, or you've got some big bills that you're backed up on, and so maybe you're starting to work a lot of overtime, or you took on a second job, or you're putting a little bit more effort into your side hustle. So there's a big temptation to, I got to take it from somewhere, so I'll take it from my passive recreation. That's a really bad idea, my friends. You can't take it from your rest, and you shouldn't take too much from your active recreation. You always need to be examining this and rebalancing it. Okay, so couple more final little thoughts on this. So your 3 R's is not the mental illness. For people who are coming in to see me for therapy, that's not really the problem. It's a symptom of the problem, right? So is this going to cure your trauma? Is this going to cure your depression? Is this going to cure your anxiety? No. But often when we're working on our mental health, we have to make sure that we got all the other little components of our life in place in order for the other thing, for the aspect of our mental health that we're trying to heal, to be able to heal, right? So this is why your therapist, if you're in therapy, is always talking to you about how much exercise are you getting, what's your nutrition like, what is your, are you taking time to do social activities with a friend, are you, or how's your spiritual game, like are you practicing any kind of spiritual faith or religion, and how do you do so, right? All of that is part of making sure that you're in the best place possible to be able to recover from your trauma, your depression, and to deal with your anxiety and all of those other things, right? So it's just a part of it, but it is a very important part of it. And I can say that with the 25 years that I've been in the field working with all of those different populations that I spoke to before, every single person that I have worked with has had at least one of those, sometimes 2, that are out of balance, and they could not get to a place of recovery without making sure that they start to learn how to get that back into balance for themselves. Hey, listen, I hope that you found this helpful. If you did, please consider giving me a thumbs up. If you're brand new to the channel, please consider subscribing. I would love to have you join the channel. If you have any questions, please drop them down below. Please be sure to check the description for any links that I may have provided, and I will see you next time. Keep taking care of your mental health. Your mental health matters.